We're back chatting with Myranda, my favorite. And people have been listening and they say they also enjoy hearing us talk.
Yeah,
Which is
yeah.
nice.
I've had people say the same thing.
They're like, oh yeah, it's like just hanging out with you guys.
Yeah, and you're so easy to listen to. I've had a couple people mention that as well. Yeah, and we're so happy that you're back as well. And if you're new, we are all about keeping it simple here with the information that we share. My name's Myranda.
I'm Jenel, and we both specialize in like women's health and, practice what we preach, which is why we're here.
Yeah, and it's just about progress, right? We're not perfect. You guys aren't perfect. We don't expect that to be perfect. And that's where simplicity really just allows for keeping things really feeling like low pressure as well, which can take away from that feeling of needing to be perfect. But that could be a whole other
episode.
Yeah.
Today we're going to talk about our 3 top things each that we see come up around pregnancy, birth, preconception, but also these can be all-encompassing for like just health and wellness through your life as a woman. Yeah. But honestly, I think these could even work well if you're like writing exams. If you are trying to get a job promotion, having these, again, foundational pieces can improve all aspects of your life. And we just don't really talk about it in the concept of women's health at all, that like, hey, there's things you could do to prevent stuff or make yourself feel better in and out of the regular life that we live.
Yeah, so just take this all and know that you can extrapolate it, and we are going to talk a little bit more specific to certain times. So should we start with the tip that we both share in common?
Yes.
Okay, take it away.
Yeah, we both share body autonomy. Amazing that we believe that knowing and understanding your body physiology and the structures that are going to be impacting our lives is important, valuable information. Of course, that's what we do for work. We've spent most of our lives studying and understanding female anatomy and physiology, biomechanics of the pelvis and the core, and can see how that trickles out into all aspects of our lives. And it's so simple for us to just blanketly name, any and all structures that we see on the body.
Yeah.
But I know that's not going to be everybody's cup of tea. Might be really boring to learn the anatomy. So just know that the names aren't super important for you. It's more about becoming into relationship with your tissue, the bones, how it feels under your hands. And if you really love learning names and stuff, coloring books are like one of my favorite ways for people to learn anatomy.
Yeah.
Because it's just a blank page, everything's labeled, and then you color. And you are amazed at how much stuff you remember.
Yeah, and so specific to preconception and into pregnancy, there's so many changes that could be coming or actually happening in your body. And when you have a baseline understanding of where you're at, that can really help us just transition through that period of change with maybe a little bit less unknown or any sort of fears, any sort of feelings that come up like, oh my gosh, I'm starting to notice that I'm swollen or I'm feeling pressure or heaviness down in my pelvis, and looking at your labia with a mirror at some point, because I know it's gonna be tough at certain stages, and being like, oh my gosh, or postpartum going, is this what my labia have always looked like? That's one thing I find in my practice is there's a lot of shock when we look at healing and recovered tissues. Especially the perineal tissues and at our vagina and within our vulva, and ladies are like, well, I don't know if it's looked like that, and we get over that because we are looking for basics of what we all share in common, but just more specifically to ourselves. I've definitely find that ladies understanding a little bit more about their core anatomy, understanding their abdominal wall and through their pelvic floor and perineum, that then postpartum we can go, okay, yeah, I had a bit of that separation at my abdomen, which is totally normal. We all have that seam. but saying, okay, so where I'm at now postpartum, actually, I'm only a little bit adapted. I'm only a little bit changed.
Yeah.
Yeah.
Also gives us a lot of confidence in our body, and its ability to have babies,
Yes.
to even get pregnant, to hold and grow life, and then birth with confidence. All comes in when you really understand that, like, hey, my perineum is like designed to stretch. I don't even need to practice that if I don't want to. It's like built in.
Yeah.
And just like having someone tell you that, because the message we get a lot of the time is like, oh no, you don't want to tear or prevent tearing. It's like, honestly, that tissue is designed to tear and heal extremely well with minimal intervention. And so the more that you can layer these little pieces of trust in with our body and the structure and honestly the design of it, it's like truly amazing. You're like, hey, whoever was the architect behind this, genius.
Yes. Yeah. And I think something that I've also observed and for myself is when we understand our body, we understand the cycles within it. That was another episode that we talked about, cyclical living. When you're understanding your body and your cycle, I've actually had ladies come back and share, hey, I was told my due date is like this, but I know when I ovulated and, when I conceived. And there's not an argument between them and their healthcare provider, that doctor, but they're also saying, hey, I know my body, right? So I'm going to follow along with that versus maybe having something external influence how you make decisions or how you navigate situations based on your understanding.
Totally. Even breastfeeding. Like, a lot of breastfeeding struggles and challenges come from the fact that, like, you've never touched your breast until you've breastfed. Like, we aren't sitting there, like, cupping our breast in our little hamburger hold. Like, until the day we try breastfeeding for a lot of us. So
I'm all up in there all the time trying to learn, but I would say on average, most people aren't, right?
And so just even, like, simple breast massage throughout pregnancy can impact your breastfeeding relationship. And even the relationship to your own changing body so much, because guess what? It's going to keep changing all through postpartum, all through perimenopause. And trust me, I've been talking to tons of women in menopause, and like the changes keep coming. It's not like, oh, we're never having kids, I'll never go through a body change. No, you still have to be in relation with your body because it's always changing.
Yeah, and that segues nicely into one of my tips. And so our shared tip is, yes, coming and just understanding your body a little bit more. I love that point that you made. You don't need to know all of the names of all your bits and pieces, but getting familiar with how they look, touching and feeling, and then how things function at a very basic level. And of course, when we have times of change, certain things are going to come up, and you might just be cued to learn a little bit more about your body, just one little area and thing at a time. Remember, we just want to keep it simple. We don't want any overwhelm. And so then when we do come into a time of change, something that I find super important is, then we've got that physical set up for success by understanding our physical body, but then understanding what are some of my tendencies when it comes to how I approach situations through my thought process, and some of my like mental tendencies, because we are going to continue to have body changes, whether we decide to conceive or not. There are just natural changes that our body goes through, and if we are very rigid and reluctant to change, we don't have a lot of flexibility, and maybe not by choice, but just because we haven't been exposed to other options, that can be so challenging. Many ladies just like, well, I always just go. I just always do it this way. Hey, that's fine. That has been helpful to an extent, maybe, right? Like, we want to have some of that rest and recovery. We talked a bit about that too. But identifying, especially throughout pregnancy, one big example is if you always have been go, busy, like I have trouble sitting down, that could be a bit of a challenge for you as you step into your third trimester and later into your pregnancy, when your body is naturally starting to ask you to slow down and change.
Yeah. And newbornhood, slow. She's slow. Babies love doing nothing. So that is a huge struggle for a lot of us because society does not ingrain that into us at all, that like, hey, it's okay to kick back and relax. And for a lot of us, when we slip into third trimester and early postpartum, but honestly, this is also quite important for preconception, is the moment of stillness. If we are going a mile a minute through our preconception journey and like piling in all of these things, oh my God, do belly massages, steaming, having sex 7 times a week, you know, like doing all this, sports, timing it with ovulation, tracking, it's like, whoa, okay, that's great. But so your egg does get fertilized. And then this fertilized egg comes into your womb. That's like, we got shit to do.
Yeah. It's like right in there, like go. Yeah.
The egg is like, oh my God, I don't know if I want to land here and implant. And honestly, implantation is a time of stillness, is a space of deep relaxation within our womb so that little egg can burrow itself in.
Yes.
That doesn't happen when we're like running around doing a bunch of things. And I think that's something that we miss as a culture big time right now is like filling our schedules, not just in parenthood, but also in preconception.
Oh, totally. And that's where I'm at right now. So my lens, I find, is a little bit more unique in the women's health world, especially in physiotherapy. Lots of practitioners coming to pelvic floor physio, learning more about their bodies because they transitioned through an experience. And I'm so grateful going, okay, well, I'm just a little bit younger and haven't gone through this journey yet. So I couldn't agree more with you in saying it's so important to learn that slow down in preconception. And that can very much be something that we have to work on as a mentality, as part of our paradigm, something that could be very deeply rooted. And so, for example, for me, right, like, why do I have this pressure, this ongoing like pressure to just do? Well, just in how I was raised.
Yeah.
So learning that it's okay for me to move slower. It's okay for me to have multiple ways to accomplish this strategy or, you know, taking on certain tasks, because ultimately change is going to be necessary, and the best adaptation is going to come with flexibility and having other strategies. So
yeah. That's awesome because it kind of leads into my second point,
okay,
which was learning like your own voice and how to discern your inner voice from the outside voices. And we all have a phone. We got billions of voices coming at us all the time.
Yeah.
And then we also have these rules kind of built into society, which is like, hey, don't trust those voices. You even have other experts,
right,
that don't know you at all, but somehow know more than you. And this is like a deeply ingrained thing, you know, 3, 4, 5 generations in, that only now we're starting to be like, do you really know? I'm not sure.
Especially after you haven't done any education or research on much women's health, right? It's like, but we know women. We haven't studied them, but we know.
And so it's even funnier when you go to the hospital, which is another reason why like knowing your anatomy is so important and understanding how cervixes work and things, because we love data and gathering data as a society, and that's no different when we go into the hospital to have a baby or if we're doing preconception labs or anything like that. And so learning to discern like what is true for you versus everything else takes skill and practice, and it's something we haven't really been kind of introduced to, especially not through public schools. They are really like anti-listen to your voice.
Stop daydreaming.
But that's a lot of like why we send people to school, right? We all want them to conform to like the same way of thinking. But when it comes to your own personal family culture or your own personal like health choices, it's very individualized. And that's the downside to, honestly, like Western medicine, is it's the opposite of individualized medicine. It's pretty much blanket policy. We expect all people coming through to present the same way through this experience that's extremely unique to that person, and then throw in the spouse. because the spouse is also impacting what's going to be going on in pregnancy and birth. And so do our doctors spend a lot of time communicating with our spouses during our prenatal appointments? Probably not, because they only have 5 to 10 minutes with us.
And maybe they're not even there because...
And so learning to discern this from this voice within really helps when you show up at the hospital. You have a brand new resident who we've been kind of told is like, hey, the expert has seen more births than you, perhaps, but not always. You may actually know more than the person coming in because they're just learning. And that's something that we have to recognize within Sask Health, is all of our hospitals are teaching hospitals. And so we do have to trust like our own internal discernment through preconception, birth, and definitely those first postpartum days. So the way that we have it set up is, even when you go to your family doctor throughout all of pregnancy, the likelihood they're going to show up at your birth. I've been to like 275 births. There's maybe like a handful of doctors that have shown up for their patient. So really knowing that like you and your spouse, your instincts, your intuition in regards to everything in this phase of your life is probably accurate.
Yeah,
because
the consistent, what I'm hearing you say is like the consistent voice is going to be you.
Yeah.
If you're showing up for appointments and every time it's a different doctor, and lots of times those notes don't even, like there's no widespread system. So if you go to a family doctor here and a family doctor there, they don't see any of your medical records.
Yeah.
They just have what's in front of them and just from their experience of meeting you. Yeah. So.
And especially in those early newborn phase days, you're like, I don't know, is this normal? Is this not? Well, you're going to spend, a couple of hours waiting at a walk-in medical clinic to see someone who's never met your child. We'll spend maybe 5 to 7 minutes with them while you're relaying like, hey, this isn't normal. Like, trust your instinct. It's probably not normal. And like, find out solutions. You could ask and specific tests. You can order your own tests when you go to the doctor. You'd be like, hey, I want a blood panel for this during preconception. You can do that.
I just did that actually. I had a phone call with my doctor just a couple of days ago.
Yeah, and then you can take those results, and if you don't know what training your doctor has, great, you could ask them. Sometimes it's even listed online on like medicalmd.com or something like that. But you could also take those test results to other practitioners, functional medicine doctor, naturopath, other people who do functional lab testing, so that you can really figure out like, what do these numbers even mean in my body?
Yeah, especially if you've been told that you're within your normal range, but something's not adding up for you. And of course, we need medicine. We need the system that we have, and we also need more information and more opportunity, because we don't need to live on these polar ends of the spectrum. Yeah.
There's a middle ground, and we are so lucky we live where we do. We can honestly pick and choose what we want to add in to our care plan. And experiment with it. Maybe you've never done like your bone density scan thing that you did the other day. It's cool. Great, now I know about it. I can go seek that out. But if I never knew about it, how would I ever know? It's not like at my family appointment when I'm getting my physical, because I'm only 37, that they're like, hey, you should get a bone density scan. Like, they're honestly going to wait and observe until they see a problem. And then I kind of call it observational medicine, where they just kind of observe what's going on, but they're not, choosing a treatment plan. And so I'm always like, you have the option to choose that, and you also have the option to say no.
Yeah, exactly. Yeah, living from the inside out.
Yeah.
That was a quote that kind of sounds like it summarizes and encompasses everything that you're saying, right?
Yep.
Focus in to what you're hearing, what feels good for you, and then when you find a provider, it's okay to ask them what their specialties are and what their expertise is. And if you get an answer that doesn't feel good, second opinions, further conversations. At the end of the day, all those voices that are going to come in, all of that information that's out there, most of the time people are trying to help you.
Yep.
And ultimately, we're going to know what's best for ourselves, especially when we get the chance to say, hey, these are your 10 different choices. What feels the best for you?
Yeah. And it's good to practice in preconception, because guess what, parent? It is more opinions, more voices on like, are you sure you want to feed them like that?
Yeah. Oh, yes.
Are you sure you want to sleep like this?
Yes.
Like, so practice makes perfect.
Yeah. It helps set you up. And so my third tip is actually nutrition. As someone who works with pregnant and postpartum individuals, something that I observe, especially postpartum and not just within that first year, but years later, is we're seeing symptoms of depletion. And that can be influenced by that go, can't sit down mentality, but that can also be influenced by lack of nourishment through food and fluids. Baby is growing because of all of the good stuff that you have built up over your years of your life. I'm just like walking around and I'm just like a bank of nourishment here. And so I'm gonna at some point give that all to my little one. And if I'm not properly nourishing myself and replenishing, things can start to come up in pregnancy and things can start to come up postpartum. And it's only been, correct me if I'm wrong, it's only probably been within the past like 3 to 5 years that like it's now more aware out there that's like, hey, what you're eating could be really influencing any sort of thyroid issues that you're having postpartum, any sort of like, aches and pains in your joints, problems with sleeping, all of that. So really getting an idea of, what are my habits with food? What are simple meals that are easy for me to make? And maybe doing some cyclical living. Jenel in a past episode talked all about your experience with harnessing cyclical living so that you had food in those times where you didn't feel like cooking.
Yeah.
And everybody knows how important it is to get that nourishment from our food. And sometimes the biggest challenge with that is, okay, well, what are those strategies that are going to allow me to get that? So we're not going to dive into that too much. And I just wanted to bring it up as one of my tips because it's so simple. We totally underestimate the power and the benefit of getting all of that nourishment through our food.
I'm glad it's trending right now that people are like talking about food dyes and other additives in food.
Yeah.
And even thinking about like how we're growing the food and what we're putting on the food while we grow it, how we kill the food and process it, and how many hands it's transferring through before it gets to us.
Yeah.
And so living in Saskatchewan, we're honestly so spoiled here because we are a farming community.
Woo.
You can honestly go to Sask Farm to Fork Facebook page and ask for anything.
Yeah, I just got eggs.
Literally anything that you want.
Yeah.
Rabbit, goat, beef, like you want duck. Like people are growing this, producing it in our province, and they want to sell it to you without a middleman.
Yeah.
It's honestly such a luxury living here because I have friends who live all over the world and they can't access high quality food for the price point that we can as easy. Ask your friends down in like large, huge populated places that don't have agriculture close to them. Like my food comes from, 40 minutes away from me, an hour away from me. They have to get it shipped from other places because maybe they just don't even have the land space available for like good agriculture. And so we're really spoiled here. Tapping into those resources will really change how the food that you're eating nourishes your body. And preconception nourishment starts well beyond a year before you conceive. So if we think about ancestral living, a couple thousand years ago, we would usually conceive after harvest when we had ample amounts of food.
Yeah.
And that was something that is practiced worldwide amongst all different people. Is they will have specific seasons where you try to conceive or you practice being fertile in. And so that might be like, we're going to conceive in the fall. Great, because all summer we're going to eat amazing fresh food and animals on pasture. So we're going to have all these nutrient stores just naturally. Now we don't care about anything like that because we got a grocery store. Sure, it's great because we live in a world where like we can't just make food all the time. That's good for us.
Convenience, yeah.
And so I do see the value in it. But you will notice a big difference if you like chew a steak, flavor, smelling it, have all the sensory organs, all of the activation of your enzymes from chewing food and having saliva. Even just thinking about it, Miranda's like, yeah. Where if we were to like talk about a shake, we don't have those like same visceral responses because we have all these other activation pathways within our digestive tract and within nourishing that like our teeth and mouth play a huge role. Our hands play a huge role. So I'm like, the more you can like feel and touch, be with your food, the more nourished you're going to be.
Yeah. That could be definitely a whole episode in on itself. So I think you've got one more
we
to
probably
share.
don't have time today. So we will do another one because it's more about birth.
Yes.
Anyways,
you're right. Yeah.
And I was going to play into like how birth is an altered state. And I could say the same thing about preconception. Preconception is really hard when we're in our frontal cortex, beta mind.
Oh, yeah.
Everything good happens when we're slowed down, in a slower brainwave state. That's where true like healing potential comes from. We don't think our way into healing, into conception, into birth.
Yeah.
It's all like a felt sense. And so, we can expand more on that next time because it was really great chatting about the nutrition part.
Yes. Yeah, I'm glad we dove into that a little bit more. So if there is anything that you would like to hear more about from this conversation or any of our other ones, make sure that you leave a comment, that you contact us both directly. We're just as excited to hear and talk about all this stuff as you guys are. And at the end of the day, just remember that one thing.
Keep it simple.